I too was diagnosed with latent tuberculosis infection and went through the treatment. I didn't have as frightening an experience, and it was actually my first contact with the public health department, and I very much appreciated their efforts in there. And I now work also where I ended up going for treatment when I was in medical school for latent tuberculosis infection. I wanted to say that it is incredibly important for public health care, for healthcare workers and for the public to recognize that TB is still a public health threat. We've heard the statistics sort of globally that 1 out of every 3 people in the world are infected with tuberculosis, which is a phenomenal figure. And worldwide, tuberculosis has a really high mortality. And we know that multi-drug resistance tuberculosis is increasing. That greatly increases the complexity and the cost of treating, and often is much less likely to be successful. So we know that globally this is a huge issue. It's important to recognize that in our country, our medical and our public health infrastructure have really minimized the impact of this on our communities. Because of this, and because of ongoing public health emphasis on TB control, TB is really not the health issue that it might be in this country. We need to recognize, however, that it does exist. And as you've heard, we have TB cases here in mid-Missouri. We have active cases in the United States. And in Boone County, for example, we have between 2 and 6 active cases a year. Cole County's had 5 active cases in the last 5 years. And there's a much larger number of individuals that have latent tuberculosis infection. Latent TB, as Tracy had mentioned, is a bacterium that the bacteria is still in the body, but it's walled off and it's not causing the individual to be sick, and they're not contagious. But about 5 to 10% of those people, sometime over the course of their life, end up becoming active. And so there's a risk of people who have been exposed in the past, who have latent, walled-off, dormant TB at this point, the latent TB infection. There's a risk of them becoming active and infecting other people. And this is where the public health effort really focuses their energy in our country. So about half of those people that end up developing active tuberculosis do so within the first 2 years of having been exposed. So when we have an active case of tuberculosis, new individuals are exposed, and right at that time, those first 2 years, they're at the highest risk of becoming active themselves and continuing to spread the disease. So we often focus a very intense public health effort when there is a case of active tuberculosis to identify all of the people at risk that have been in contact, to test them, to offer treatment to decrease the chance that those individuals are going to go on and become active and continue to spread the disease. I'd mentioned that in Boone County we have several cases a year, and that might not sound like a lot, but the impact of those cases on public health and on community resources can be immense. Last year in mid-Missouri, we had a case of active tuberculosis in an individual who exposed hundreds of high-risk people, of people who were at high risk of becoming ill and potentially progressing to active TB. And the follow-up investigation of that required just an extensive coordinated effort between the medical community and between public health. It involved several states. It involved regular consultations with CDC and with national TB experts. It involved testing and follow-up of hundreds of people, and we're still in the process of tying together loose ends on that case. The reason that that effort is done is to identify anybody who potentially has become infected by that individual so that they can receive treatment and decrease the chance of spreading it to others. And just to give you an idea of the impact of that on local resources, we've estimated that the local public health department that was involved in this investigation, that single case investigation ended up costing over $100,000. And it's not over yet. So the community probably spend an equal amount. So it's often an incredible effort to try and follow up on cases of active tuberculosis to prevent their spread. And it's because of this effort that we really decrease the risk to the people in our community. And so one of the things that we really hope to emphasize with today's event is just how important it is for the medical community and public health to work together to combat TB when it's there, and to be very aware of this as still a very real public health threat. As a healthcare provider, and as other healthcare providers, we need to be aware that TB is out there. We need to have TB, we need to think about tuberculosis. And when individuals have symptoms of active TB, a cough that lasts greater than 3 weeks, there's all sorts of things that can cause a cough that lasts greater than 3 weeks. But as the public and as healthcare providers, we need to be aware that one of the things that can cause that is tuberculosis, and we need to evaluate for that. The cases that sometimes result in many, many, many people being exposed are because people are unaware that they have developed tuberculosis. And the cases, the fatalities that we've had here in Missouri, those 39 people that have died over a 5-year period, those are individuals that did not receive treatment in time to protect them. And so they died either before they started on treatment, before anyone had identified tuberculosis, or before they were able to get enough of the treatment to end up impacting their health. So I would like to encourage all healthcare providers and the public to be very aware of tuberculosis as an issue in mid-Missouri. So anyone who has a cough more than 3 weeks, anyone who has night sweats, unexplained weight loss, anyone who coughs up blood, it's really important for them to be evaluated quickly and not to say, oh, I think it might be something else. It could be a cold, it could be my allergies. And it's very important for healthcare providers to be aware of that in our patients and also in ourselves, because it's not unheard of for healthcare providers to themselves become active cases and spread disease. So I guess I would just like to say in summary that it's our hope that the medical community and the public and public health can continue to work together to really decrease the impact of this very serious disease on the citizens of our community. Thanks.